Dr. Parker, can you provide an overview of uric lowering therapies? What are they and how do they play a role in managing gout?
Sure. As I transition to medicines, I'm going to um, follow up on Dr. Edwards' very practical and pragmatic advice in that regard. And I'll also say that it's very common for me to have a discussion with diet. And advocate the exact same things that Dr. Edwards does. And I really try hard to get the patient and the family members to stop beating themselves up when they flare. This is a common thing that I see. And so just like Dr. Edwards said, I say, listen, you want to have a common sense diet, and trying to eliminate or put X's on all alcohol and all shellfish and all this, that, and the other thing is completely not doable for anybody. I remind patients that I have Olympic athletes in my clinic, professional athletes. These are disciplined people. And if I said, you don't do any of that, they would look at me like I'm crazy, which I would be. No one can do that. Just thinking this is a genetic illness with lots of other things going on. Have a good diet. Eat your vegetables, eat your fruit. And then I can help you with medicines. That's my segue, Stephanie, to your question. I can help you with medicines to assure you always have that uric acid under control. And so to think your gout is controlled because you're not flaring, if all you know is you're not flaring, you need to know, just like a diabetic needs to know what their sugar is. If you have gout, you need to know what's your blood uric acid level. I can help you with that with medicines, right? So you're doing your diet, and I have pills that are generally one pill once a day. I can adjust the dose. I can titrate, or I look at it like I'm cooking. I have all these spices, and I'll do a little of this and that and the other thing to keep that uric acid in a target range. And so I say, listen, I'm going to put the target right here, and I want you between 2 and 6, right? I give them a number, clear visual of what we're trying to achieve. And the better you are at diet, not fudging it, the easier I'll have with using common medicines. The most common throughout the land, allopurinol, not just the United States, but the world. One pill once a day, inexpensive, tried and true, been around for decades. Beautiful safety profile. Now, there's no one size fits all. If for some reason you didn't tolerate that medicine or was ineffective, yes, I have other pills. Uloric or febuxostat would be another one. Again, it's a pill once a day. I have to adjust the dose to achieve that bullseye that I mentioned earlier. Rarely will doctors throughout the land use probenecid, but this one works differently. It helps our kidneys excrete more uric acid. And that one is not one pill once a day, so it's got a hassle factor associated with it, but it's inexpensive. All these meds that I've mentioned so far are generic. Some people, some unlucky people that have very bad illness, whether it's gout or something else, and some people need not pills, but temporary periodic IV medicine that really lowers uric acid down. And as I call it, clean house. So it's called Cristexa. Clean house, get that uric acid down, really clean up the house. Then I transition you to pills shortly thereafter, usually months later. Then they're on their pill. That's how I get people's uric acid down. I'm checking the labs along the way, depending on how often you're flaring.
Thank you for the overview.
Sure.
Dr. Edwards, to build on this, can you talk about missed doses of ULTs and why
Hmm.
is adherence to ULTs important?
Yeah. So, as Chris was saying, the whole problem with gout is the accumulation of monosodium urate crystals, uric acid crystals around the joints. And as long as you have these crystals, they're the triggers for the flares, for the joint destruction, for the chronic arthritis if left untreated for a long period of time. And so what you're trying to do with the drugs that Chris mentioned is to get the uric acid level down to a low enough place that instead of uric acid coming out of solution and crystallizing, it'll do the reverse thing. The crystals will dissolve and go back into the serum, and you'll urinate them out. And that's the whole ticket. The urate lowering therapies that are oral, the allopurinol and the febuxostat predominantly, are important in that they can lower the uric acid level down to less than 6 is our target zone, and my personal one is actually less than 5. Um, and when we do that, then the uric acid level stays nice and calm. What causes a flare is for a dramatic change in uric acid levels in the serum, either a dramatic rise that you might have if you decide to do a 6-pack of beer this evening, that your uric acid will go up, and that's what triggers that problem. Or if you have all you can eat shrimp down at your local place, it causes uric acid to go up. The other side of the coin is that if you do something dramatically like put you on a very high dose of one of these urate lowering therapies, it drops down. So either one of those things kind of destabilizes these cluster of crystals around the joint, and it triggers the flare. So yeah, not missing one of your daily doses of either allopurinol or febuxostat is important, because then going back on it will cause your significant variation in your uric acid level. Taking a particular medication, most people, like I mentioned before, with gout, have other metabolic diseases that they're on a blood pressure medicine for, or maybe some sort of heart control medicines. And the uric acid lowering therapy should be right there with your other medicines, and you shouldn't be missing the dose of it.
Thank you, Dr. Edwards.
Stephanie, I agree with everything, but I will say that as a fellow earthling who takes medicines, if I do accidentally forget to take my pill, I realize it later and I just go, oh, darn, should I take 2 and catch up, or just start over? I would say you don't have to take 2 to catch up for reasons that Dr. Edwards just shared. I'll just say, if you missed one tomorrow, you just take it again. Try to put it next to your toothbrush if you're a person who brushes your teeth, that is, so that it becomes like autopilot types of things that you rarely miss it. And then that kind of consistency will transition into, number 1, no cavities. If you're brushing your teeth, no gout flares eventually.
I hope everybody on this webinar brushes their teeth. But that's actually a very good idea to remember to take any medicines you need.